So my name is Dr. Moses Kumi. I'm a nephrologist with Carolina Kidney Care. We take care of patients with chronic kidney disease, patients who are on dialysis, both in our office and in the hospital, and also in the dialysis clinics in the Cumberland and Robinson County area. We see also patients who have uncontrolled blood pressure and patients who have issues with their electrolytes. Today we're going to discuss diabetes and its effects on kidney disease. Diabetes is becoming a big disease or problem both in the US and the whole world. Over the past 20 years, the prevalence of diabetes has increased from about 6 to 10% of the population. And this has a huge impact on kidney disease. We have about 25 to 30% of patients with diabetes developing chronic kidney disease. We have what we call diabetic kidney disease in patients with diabetes. This is one of the complications of diabetes generally on the human body. Some of the complications of diabetes, as we know, include stroke, heart disease, including heart attacks, vision loss, kidney failure, nerve damage, and we have people losing their legs because of diabetes. So diabetes is we call it a multi-system disease, and that needs to be taken very seriously. We're going to concentrate on diabetic kidney disease today. When do we say somebody has diabetic kidney disease, or what are some of the symptoms? Unfortunately, as a patient, you're not going to be able to detect or know yourself whether you have diabetic kidney disease or not during the early stages of the disease. That's why it's so important that you follow up with your primary care physician, your endocrinologist, or nephrologist if you have one, so that they can monitor your kidney function very closely. So diabetic kidney disease results from diabetes, as the name implies, and when your blood sugars are not well controlled, then your risk of developing diabetic kidney disease is very high. So it's very important that you keep the control of your blood sugar within the acceptable range. And we usually shoot for a hemoglobin A1C of 7% to really help protect your kidneys. So when you have diabetes, especially when you have the type 2 diabetes, usually by the time you are diagnosed, years have passed before we detect it. So as soon as you are diagnosed with the type 2 diabetes, your physician will start checking your urine for what we call albumin, that is protein in your urine. So when we have protein in the urine, that is an indication that there is some damage in your kidneys. What we measure is albumin, which is the same thing as protein. So normally we lose a small amount of protein in our urine, but when you lose more than what is normal, which is about 200 milligrams, then we say you have early stages or evidence of diabetic kidney disease. If you have type 2 diabetes, the recommendation is to have this done every year, at least once a year. With type 1 diabetics, since we know when they develop their diabetes, usually it takes up to about 5 years for us to start checking their urine for protein. Again, what are the signs and symptoms of diabetic kidney disease? For the patient, you're not likely to notice any symptoms until your you've lost about 70 to 80% of your kidney function. So if you're not following up with your physicians or your doctor then by the time you get to your doctor, or by the time you go in because of symptoms, you might have caused a significant damage to your kidneys. One thing I want to mention here is that not everybody who has diabetes develop diabetic kidney disease. Up to about 40% of people with diabetes will develop diabetic kidney disease. And this, we think it depends on, there's some genetic factors that we're not entirely sure. So some of the risk factors that really increases your risk of developing diabetic kidney disease include age. As we age, as we get older, our risk of developing kidney disease increases. As with everything else, function of every organ in the body goes down as we age. So it is with the kidney. Race and ethnicity. For some reason, African Americans, Mexicans, some Hispanics, Native Indians have increased risk of developing diabetic kidney disease. A lot of research has gone into why this is happening in this population, but nothing much has been found. Other factors are sex. Female, for some reason, are prone to developing diabetic kidney disease than men, but once they develop it, the progression of the disease is more significant in men than the women. I guess because women are better at taking care of their health than men. 4 other risk factor is low socio-economic status of patients. So here again, I mean, if patients' economic situation is not adequate, they tend not to take very good care of, or they don't have the means to take care of themselves properly. 5, obesity, also predisposed to kidney disease. Smoking is very, very important. Even without diabetes, if you're a smoker, you do cause a lot of damage to your kidneys. 7, blood sugar level. This is very, very important. You're a diabetic, and this is from blood sugar. So if your blood sugars remain high, then it's going to cause damage to your kidney, and it makes it even worse with time. 8, high blood pressure. High blood pressure is one factor that's very, very important in the management of diabetes, because if your blood pressure is not well controlled, you accelerate the damage to your kidney. 9, as we measured, genetic factors, and 10, if you, for some reason, you develop acute kidney injury, then you are predisposed to developing chronic kidney disease. So